This clip is sponsored by Med Travelers. If you're an SLP interested in travel therapy, visit medtravelers.com to get started. When you're doing a TBI, what is your preferred assessment for TBI? And again, what informal and formal pieces do you incorporate there? Yeah.
So it depends on the severity of the TBI, and it depends on a lot of factors with the patient and with the client. I have a gentleman that my students and I are evaluating this week. We're using the RBANS. It's RBANS. It's the repeatable battery assessment for executive dysfunction, I think is the acronym, but anyway, RBANS. Okay. And it is a fantastic assessment that looks at working memory, it looks at processing, it looks at visual spatial deficits, it looks at all those things. And it's nice because it is repeatable. There are several different versions that you can compare side by side. I like the T. It's the test of everyday assessment or everyday attention. The only issue with that one is that if you do not know how to complete that test backwards and forwards, inside out, you will not make it through the administration. It is so challenging the first couple times you do it. But once you get a handle on it, it's great.
Why is it challenging? Just because it's so...
Because there's this auditory component where you have to count these beeps. Oh. And it's like up, 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 down, down, down. And you have to learn what all the sounds mean. And it's incredibly overwhelming. The first time I practiced doing it at my dining table, I asked my then 15-year-old to come over and I was like, just be my guinea pig for a minute. And she was like, Mom, you can't give this to a person with a brain injury. That'd be mean. I can't even do this. And I was like, babe, that's why I need you to do it, because I need to practice. But it is really challenging, but it is an excellent test of finding where the patchy parts are in somebody's attention. I love the BADS. It's the, don't quote me on any of them. Those are what they stand for. But the BADS, the T, the SCAT-B, the RBANS, and sometimes the CLICKIT, the CLQT. All of those tests, just depending on what the patient or client needs. So if you feel like they're not going to be able to get through a full hour, then I'll usually do the CLICKIT with them because it takes about 25 minutes or so, and we can really easily pause and take breaks. And some of them are talking tasks, some of them are writing tasks. So it breaks it up nicely where they can take a break from one or the other. And then of course, if their brain injury has anything to do with the left hemisphere, we'll typically go for a Western aphasia battery as well, because if we need to understand what their language capabilities are through the lens of their brain injury, and understand their brain injury through the lens of any language deficits as well.
And so I'm just thinking, there's so many choices. And you may not have a ton of information about them before beginning. Do you sometimes ever, okay, I'm going to have two ready, and if this is a complete bust, then we're going to switch to this one?
Yep.
Okay.
Very frequently. I have two, maybe three ready to go in my bag, just ready to hit the ground running. Mm-hmm. A lot of times also at the hospital, I'll pop in before their session when I know that they're in their bed or in their wheelchair, and just introduce myself. Hi, I'm Angela. I'm here from speech. I just wanted to come introduce myself and let you know I'll be coming by later on. We'll be doing lots of thinking and memory and talking things. So let me know if you have any questions or concerns. How's rehab treating you? What therapies have you had today? And just kind of really, really informally assess what's happening and what they're capable of when I walk in the door unexpectedly. And then I can be a little bit more prepared when I'm doing the administration of the test.